Over 1,800 doctors are impacted across the country. What happens to these doctors?
You find yourself being so skilled, yet you are just helpless. We're being advised to leave the country. Other people are just leaving the profession. They're doing other things. Other people are taking their lives because they're like, what is this? Because this takes a toll even on your mental health. Even me, at some point I am going to break down because
Guys, I really do hope that the GNU has plans for South Africa to have an excellent end of the year 2025, because the beginning of 2025 isn't good from what I'm seeing. This spokesperson for unemployed doctors who are actually protesting currently at the Eastern Cape is actually arguing that as much as 1,800 doctors are being advised and might likely have to find a way to leave South Africa. That's a huge number of doctors, 1,800. In my last video, I spoke about how 38,000 taxpayers might likely be leaving South Africa. 1,700 millionaires are moving with all of that taxable income out of South Africa. And now coupled with this huge amount of doctors leaving, it's either there are two ways to really, address this issue. It's either there's going to be an influx of foreigners to replace these doctors, and then have doctors in South Africa, or hospitals in South Africa, being manned by foreign doctors. This same problem with foreigners that South Africans are really unhappy about and really been complaining about. So we might likely be seeing a huge exploding bomb, so to speak, tensions coming to the fore as we see these really unfortunate circumstances coming to the fore. Let's quickly listen to this spokesperson for the unemployed doctors in South Africa really narrate the plight that she speaks about. She speaks about how the conditions of being a doctor, especially at the Eastern Cape, has actually been that they were forced to practice what she calls bush medicine. Normally, they were supposed to be practicing preventative medicine, but because of the whole issues, and I suspect this has to do with funding and financing from the level of the government and the ANC, this is a problem that's been brewing. She argues that they've been forced to practice bush medicine. She actually argues that they've been forced to practice damage control rather than practice the profession of medicine. And she's actually been exposing the rot and the corruption in medical care, where an official, I think these are government officials, actually can call directly to the doctors to attend to their patient. But when it's a regular patient, a South African, for example, they have to find a way to make do. And there's lots of people really getting dead at the ward because of unstaffed hospitals and lots of really unfortunate instances. Let's quickly listen to her break down the plight of these unemployed doctors, as much as 1,800, and I'll be back for a really intelligent analysis on this.
Given, because my understanding is essentially a circular comes out from the Eastern Cape Department that essentially sees community service delivery personnel released from their duties as of New Year's Eve. The reason that you get, and just how many doctors are impacted, or health personnel?
they say they don't have money, and it's more than 150. There's medical doctors and dentists that have been picketing outside. So it's us, and then there's dentists as well. So they have joined us. There's obviously other healthcare practitioners who are left stranded, but as of now, it's the medical doctors and the dentists that are outside, that have been outside the Premier's office.
Yeah, and then there's the issue of timing, right, as to when the circular was released. I mean, could there have been earlier engagements?
Yes, it should have been, because we were proactive in engaging them. I think it was about in August when we sent them the first email. When I sent them the first email, it was in August. They only had one meeting with us, which was just for us to tell them what we want. And we told them that we want to engage them early because we saw what happened to the 2023 cohort, and we don't want that to happen. So what's going to be the plan? Because some of us have bursary obligations to fulfill, which is serving for the time that the bursary has funded us. So if it was for 5 years, you are obligated to start serving for your bursary post ComServe. So 2025, we were supposed to be starting to serve for our bursaries. other people are not bursary holders, but we're here. We want to serve our communities. I'm not sure what was the other part of your question.
Yeah,
Sorry.
it's okay. And I actually just want to get into what the impact is on some of these health facilities, because ultimately you were serving people, and what this means. And if you could perhaps describe some of the health facilities that some of these doctors were working in, the gaps that possibly could be left behind by these doctors.
Let me talk about Mthatha Regional Hospital, where I was working, which is my lived experience. I worked in the family medicine department, so we're essentially the face of the hospital. So everyone who comes in, they'll either go to casualty, which is managed by us, or to trauma, which is also managed by us, or to OPD. So many of the departments that are within the hospital are mostly fed by us when it comes to patients. So we find ourselves knocking off late. Even the consultants will have to come and assist in OPD because patients are not finished by 4:30. They have to leave. We have to leave late at around like 6:30. That time you're expected to be back at work at 8. In casualty, we have ridiculously long waiting hours. Like if you know someone who's in Mthatha, they will tell you that even to wait for blood results, you have to wait about 8 to 12 hours. We're still just waiting for your blood results, and not all of them are going to be out at that time. Then you'll be discussed with the relevant department. In trauma, you find out that with trauma you deal with head injuries, all those things, orthopedic cases. There'll be rosters that won't be filled. Like in the statement that I released earlier this evening, I mentioned Indaba Yase neurosurgery, Nelson Mandela Academic Hospital. That department is severely understaffed, and I don't understand why the department, because I'm sure they are aware of it, because everyone knows. I don't understand why they have not employed doctors for such a critical department where many litigations can come in. Even maternity is understaffed. A friend of mine, Dr. Olotan Makungwane, he was working as a medical conserve in Ops and Gynae up at the regional hospital. They were doing commuted overtime, extra overtime. They were doing about 90 something hours of overtime, whereas the maximum should be 80. It's 60 to 80. So I'm just trying to show you people are dying in the wards because there's not enough doctors to even have weekend covers to say, okay, all the wards should be adequately staffed, because even that person who you're going to say is for a weekend cover has to go see emergencies as well, take consult and all those things. What else? Oh, there's a lot. Patient waiting times. You will call a department, Nelson Mandela, and you are querying a malignancy, and you'll be told that the next available clinic date is in 6 months' time. Now, tell me, how do you relay that to your patient who also borrowed money to come here? It took time for even them to come for their date, and now you have to tell them that they have to wait six months for them to get a scan, to stage what could be a malignancy, maybe, to get a CT staging. And then by the time that CT staging is done, or Yongelondole, what do you think will be the outcome? So there's a delay in patient care. There's just an increased burden of disease. We are practicing a curative medicine, or this is not even curative medicine. I don't know what we're practicing. It's bush medicine. Because we are supposed to be in primary healthcare, we should be mostly focusing on preventative care and measures, but we're not doing that. We are just doing damage control. And I don't know until when. Even when we were in the system, there was severe understaffing. So now that we're out of the system, I think the government thinks that community service and interns are replacements, but they're not, because there's people who are actually employed as full-time doctors, but some died, some have left for better opportunities, or for whatever reason, maybe moved to private healthcare. Lena or Dr. Aaron Matsolidu was talking about. So I don't know what's going to happen, because those posts are still vacant. There are posts, but they are vacant. We are told that they are not funded. So it's the same as them not being there. And The sad thing and the frustrating thing is that the people here at Bisho, when their relatives are going to Mthatha General, because people love Mthatha General Hospital, we serve people from as far as Alwal North or Siki or Banban, because they know that at Mthatha Regional Hospital we don't turn them back. So when relatives of these officials go to Mthatha Regional Hospital, we get calls, Tina, from management that so and so is outside, a patient so and so, they've not been seen, and you'll find that it's a very cold case. It's an OPD or even a clinic case, but because they know someone at Bisho, and Bisho will call us demanding that we have those people seen. So it's a confuser, because they know what's going on there. They know that we are understaffed, but for their people, we make plans. We have to make plans. But now, when we want to have adequate staffing at those levels, so that no one even has like something to complain about, no one even calls because they took like 6 hours to get seen for their painful thumb or
Yeah.
whatever. Yes, 4 years. I don't know. I really don't know what they want us to do.
Sure. You're painting, I mean, it's a harrowing picture that you're showing us of what goes,
Horrible.
yeah. Here's where it gets extended, because the South African Medical Association has also spoken out and said that they are concerned about the alarming number of junior doctors who remain unemployed despite them completing community service, saying that over 1,800 doctors are impacted across the country. I mean, that's a big number. What happens to these doctors? I'm just thinking about the sort of costs and years that go into training as a doctor. And then what happens to those skilled individuals when they're not absorbed into the system? What options are available?
Very, very, very hard options, because now we're being advised to leave the country. And when you grow up in a very disadvantaged community, and you see the people suffering, and you know what you can offer, and then you strive, you do your best, you do your best at school, you get good marks, you go to medical school, and you're like, one day my grandmother will not wait in line for such a long time, because I will be one of the doctors that will be there in casualty assisting. I was so happy that I was at Mthatha Regional Hospital, because I'm the regional from Mthatha. So I was ecstatic that I was able to serve my community last year. But now I know that I'm leaving them with space. I'm leaving space that will be unfilled. So it's just a cycle. And some are going into private practice. And in a private practice, I need people to understand that it's for privileged people. We know the poverty rate as in South Africa. Even with that 350 grant, you can't afford a consultation with a GP. Other people are just leaving the profession. They're doing other things. Other people are taking their lives, because they're like, what is this? Because this takes a toll even on your mental health. Even me, at some point I am going to break down, because this is weighing heavily on my mental health and mental health of other doctors here as well. So you find yourself being so skilled, yet you are just helpless. We're feeling helpless, because in as much as we were struggling even when we were employed, because we had to constantly improvise, but at least you felt like you're doing something. Now you're just outside, camping outside the premier's office, who's celebrating ANC's birthday. Like,
Yeah, brilliant, guys. So let's really understand what's really happening, what's really going on. I saw here on this website called Algoa FM, I think this is a news station. He actually argues that Samatu demands actions as hundreds of doctors remain unemployed, all right? And this is as of 8th of January 2005. It says the South African Medical Association Trade Union, SAMATU, has actually expressed deep concern over the escalating crisis of qualified doctors who remain unemployed after completing their community service. And these are not, I don't know if probably these are 30% grade. I'm still conducting my research on this whole 30% grade, so to speak, problem in South Africa. But it says that these are qualified doctors, right, who are unemployed in South Africa. The union reports that in just 24 hours, it's recorded over 450 unemployed doctors, and that number is still rising. Where this number is really, where they expect these guys to go is really, it's really a struggle for me to understand. It says that in a statement, Samato criticized the National Department of Health for failing to develop a clear strategy to retain these skilled professionals despite years of engagement with successive health ministers. And now we know that the health minister now is Aaron Motsoaledi. I'll be doing a video on that where he argues that the government simply doesn't have money to hire these people. There's no money, you see. So it's really a difficult, complex problem. It says provincial chairperson Dr. Mpumelelo Melamane actually said that the union engaged with the head of the department and the MEC last year to prevent the issue of unemployed doctors and the need for mass action for the fourth consecutive January. So it's been like 4 years now. Every January, this case still comes up to notice. He said that he then stated that the department announced that it has no funds to hire doctors. All right, so that's the major problem. Ministry of Health seems to not to have money to really hire doctors, as much as 1,800, and probably that number is still more. What they're going to have to do is really unclear at this moment. It says in the Eastern Cape, over 150 unemployed doctors are picketing outside of the Premier's office, as you could see in this video, in Bisho this week, demanding jobs. You see, this whole thing with jobs, I really hope that we really can find an alternative. This is not even just a South African problem, it's all over the world. This problem with jobs. I really don't know how we can really start slowly thinking in terms of an alternative. But anyway, this is actually the case now. It's unfortunate. When you think about a doctor, growing up in Nigeria, thinking about a doctor, you don't associate, it's really difficult to associate unemployment with being a doctor, because that was the go-to profession. Everybody wanted to be a doctor, but it's strange. It's really strange. It says that on Monday, these 150 unemployed doctors in the Eastern Cape handed a memorandum to the Chief of Staff, Siyabulela Oncleya, right, calling for the reallocation of funds across departments and vowing not to leave without confirmed start dates for the employment. It says that Dr. Melamane said the union fully supports the picket but rejects claims that the department lacks funds. So they do not believe that the department lacks funds. There's just something sinister going on. He said there's no need for a reallocation of funds and that there are funds within the department. It's just a question of political will. So it's an issue. That's why I said it's something about there's just something we don't really yet understand. He says he pointed out that millions of rand are allocated to the 2024-2025 financial year for hospital refurbishments and building new wings in existing facilities. They cannot commit such funds to build new hospitals when they do not have people to work in those facilities. So in other words, it's like the government, there's a plan to set aside to build new hospitals, but then there's this large mass of doctors who are supposedly planned or probably supposed to be unemployed. In other words, there probably might be a new plan to man these new hospitals with some doctors, I don't know where. But this is what this whole article now is actually insinuating. It says Dr. Melamane emphasized that the Provincial Department of Health should employ doctors after they complete their community service. He also highlighted that some doctors are bursary holders, obligating the Eastern Cape Department of Health to employ them. He warned that if administrators were unwilling to make necessary changes, the union might be forced to organize mass action, which he described as totally unnecessary. But, we know. He says that as a union, we have not resolved to make a formal strike, but we might be forced if nothing changes. And the nature of strikes, if there's a strike in the health industry, that's going to be crippling down the country once more. And I think South Africa is at the place where it doesn't really need this whole issue. This is a country that's trying to breathe. There's a lot of problems going on and it's just so complicated, and these kinds of things shouldn't actually be occurring at this moment. I really felt the the pain in the voice of this spokesperson here. You could actually feel, she see when she spoke about her mental health, that she's really just trying to hold on and strong, spending all those years studying and practicing, and at the end of the day here is such an embarrassing place where a doctor is literally begging to be employed. It's tough. It's tough. I don't know. I don't have anything to say here, but I don't know. What do you guys think about her speech here in this video? Share your thoughts in the comments.